Good evening, everyone. My name is Bridget Kramer, and this is my alternative therapy presentation. For this presentation, I'm interested in learning about canine-assisted therapy, specifically service dogs. I have two beagles, Moxie Kramer and Buster Kramer, and they are my best friends. I know for myself, my dogs greatly enhance the quality of my life. They bring me endless amounts of joy. I would love to work with military-connected populations in the future. In the past, I was a substance use counselor and worked with veterans. Military-connected populations are a unique and diverse population. They bring to the table a vast array of strengths and challenges. In the future, I would like to be part of my community service members and veterans support system, offering evidence-based mental health interventions via counseling and therapy. After I receive credentialing with the VA, I plan on reaching out to the local veterans organizations. All right, so let's get started. Background. Service dogs began their history helping World War I blind German soldiers with daily living activities. In the United States between 1920 and 1940, guide dogs were seeing eye animals. In 1967, Canine Companion placed the first service dog. And as we know from our studies, in the United States, the 1960s and the 1970s were a pivotal time that fostered advocacy and speaking out about inequity that existed within our country, not only for Blacks, but also for disabled individuals. Service dogs were primarily used to help individuals with disabilities. The 1990 Americans with Disabilities Act gave legal protection to service dogs. The policy stated that a service animal is individually trained to perform tasks or do work for an individual with a disability. The ADA states that service dogs are permitted to have public access. A service dog is considered medical equipment. Fast forward to Operation Enduring Freedom and Operation Iraqi Freedom, statistics have shown that returning service members had high positive screenings for PTSD. In 2006, the NEEDS organization placed the first service dog with a veteran, a bilateral amputee. The veteran served in Afghanistan. The NEEDS organization and Canine Companions are credited with developing and piloting service dog programs for veterans. A service dog is trained to assist a veteran who has been diagnosed with PTSD. They can assist by waking the veteran from a nightmare, lying on top of the veteran, or lying with the veteran to provide a calming sensation. The service dogs are specifically trained to recognize distress, hypervigilance, anxiety, and then they are trained to also intervene. They are assisting with the invisible wounds or disabilities of war. Public broadcasting stations, otherwise known as PBS, documentary Dogs of Service interviewed Zach Fox, who served in multiple combat tours as a machine gunner. He noted that when he came home, he was a recluse and experienced PTSD symptoms. He credits his service dogs to helping him become more active in his life, reduce his medications, and be able to be in public. This is how the service dog can complement conventional treatment by intervening when a distressing event happens, by helping the owner to calm their nervous system so they can engage and use their prefrontal cortex and not be purely behaving based on their amygdala. In 2021, the Pause for Veterans Therapy Act, Puppies Assisting Wounded Service Members Act, legitimized service dogs for veterans with PTSD. This act required the VA insurance policies to cover service dogs for veterans. So now that we know the background of how service dogs came into being, let's talk a little bit about the literature and the effectiveness of service dogs. The literature that I researched for this presentation indicated that veterans with with service dogs experienced reduced PTS symptoms and a noticeable improvement in their quality of life. The literature provided major findings that service dogs help veterans to navigate daily life, facilitate social opportunities, and transform the veteran's sense of worth and well-being. According to Crow and multiple authors, veterans reported that their service dogs helped to improve their occupational performance in their homes. And Crow and others also conducted a qualitative study, and their results illustrated that service dogs provided physical safety, peace of mind, supported healthy behaviors like sleep, medication and pain management, physical health awareness, and emotional awareness. They noted my service dog, my hero, and influenced family and friends relationships. A non-randomized efficacy trial conducted by Marguerite O'Hare and Carrie Rodriguez at the College of Veterinary Medicine at Purdue University proved their proof of concept. And what this means is that veterans who had a service dog and continued with their mental health care had a significant reduction in PTSD symptoms compared to the control group who only received their usual care. And according to O'Hare and Rodriguez, the longitudinal effectiveness trial has provided initial evidence that compared with usual care alone, military members and veterans with trained service dogs show lower PTSD symptomology, reduced depression, and increased social participation. Another study that I took a look at conducted an ecological momentary assessment of 168 veterans with and without service dogs to study the emotional and social health, specifically how PTSD directly impacts the veterans' lives. The study concluded that service dogs have a positive impact on psychosocial functioning. The veterans in the study with the service dog reported better emotional functioning in the study's measured areas. According to Layton and others, the veterans with service dogs noted better perceived quality of social interactions. The study pointed out that the veterans reported a greater negative affect when their service dog performed an anxiety interruption task. And you may wonder why that would be. The study concluded that it is the service dog's presence that is meaningful related to a lower negative affect, outweighing any task-related associations present. The literature's strengths are that the results demonstrate the effectiveness of service dogs being placed with veterans by the PTSD symptom reduction, increased functioning and navigating daily life, facilitating social opportunities, and transformation of the veteran's sense of worth and well-being. The literature's limitations are that longer follow-up studies are needed, and studies also need to address the differential outcomes between a service dog and a pet, also variations in service dog organizations, and more studies that provide evidence that specific interventions like CBT with a service dog result in a loss of diagnosis. Okay, now on to the really good stuff that I found so wonderful. The case study, I did my case study on Puppy Jake Foundation. Puppy Jake Foundation is a nonprofit organization, 501c3, started by Becky Beach. They're located in Urbandale, Iowa. They started in 2013. Excuse me. Becky fostered a dog named Jake for a local service dog organization. This experience led her to realize there was an incredible demand for service dogs for veterans. The Puppy Jake Foundation is a veteran-specific organization. Veterans can apply, and there is an approval process for them to get a service dog. The Puppy Jake Foundation offers other veteran services such as Dog Perfect, which is training for veteran dogs, owner-trained service dogs, and adoptable dogs, and those do have a cost associated with it. They have placed over 50 service dogs with veterans over the past 10 years. And their evidence of effectiveness can be found on their website, The Stories of Healing. PBS, a dog service documentary, features numerous veterans who have received service dogs from the Puppy Jake Foundation. The documentary covers specifically the 2-year training process that the Puppy Jake Foundation uses. I would highly recommend watching the documentary. It has powerful and moving interviews with veterans who have service dogs and how their service dogs have transformed their lives. The service dogs are specifically trained to recognize distress, hypervigilance, anxiety, and then they're trained again to intervene. There's 5 phases that all of the service dogs go through. Puppy Jake Foundation service dog training. In phase 4, the service dogs are put to the test by flying, by going to big cities, going to festivals, going to concerts. Then they are matched with their veteran. It's really important that the service dogs for veterans be able to be out and about in the public in very busy spaces. The purpose of the service dog in busy places for the veteran is to provide a barrier and also to be alert for hypervigilance. Puppy Jake Foundation notes that they are assisting with the invisible wounds or disabilities of war. They are dedicated to helping wounded military veterans with the assistance of well-bred and professionally trained service dogs. Veterans' injuries may be invisible, such as post-traumatic stress disorder, PTSD, or physical mobility impairments. The Foundation advocates for increased awareness and accessibility for those accompanied by service dog in everyday situation. For more information, please visit their website. They have a great website. Go check it out. All right, so for my discussion, I would recommend this approach. We learned in this class during week 5 that the VA recognizes CBT, PE, CPT, EMDR, and the VA recognizes the listed interventions as gold standard interventions. I think that service dogs could be used in conjunction with the above interventions. If a service member can function effectively in their life, it may be easier to attend therapy. It may be easier to go out in public. If an individual is experiencing difficulty in life, practicing avoidance and using substances as coping skills, then they're probably not going to show up for therapy. Service members often drop out of therapy. The service dog can help to fill in the gaps at home by providing tasks that help the veteran to stay engaged in their life and avoid getting caught up in their anxiety. The Puppy Jake Foundation notes that it takes 2 years, $25,000, and hours of training for one service dog. The concerns are that there are many veterans that would like a service dog, and the wait can be long. In conclusion, service dogs can be a wonderful, loving companion and a helper to a veteran. The literature provides plenty of data that supports service dogs as an intervention for veterans with PTSD. There is a lot more work to be done, and that is recognizing how many veterans would like a service dog. More research and empirical studies are needed to demonstrate the effectiveness of a service dog along with the gold standard intervention. And my hope would be that when there's more research, more empirical studies that demonstrate the effectiveness of the service dog along with the gold standard intervention, then how can the government begin to provide more funds to increase the supply? I thank you for your time today. I appreciate you. Here's the references that I used. And on this page, you can find all of the resources that I have talked about within my presentation. And I will leave you with, there is no greater earthly privilege than to be loved by a dog. Thank you. Have a great night.